Hypothesized risk factors for developing TMD number 1. Improper occlusions due to dental malpositions such as missing teeth, edge-to-edge bite, excessive overbite, or underbite. The research supporting it so far is questionable. Improper occlusions due to dental malpositions used to be considered a major factor to development of TMD by many dentists. However, its importance has decreased due to conflicting evidences. Basically, there's insufficient evidence to support the use of occlusal rebalancing either as treatment or for prophylaxis. The truth is that the vast majority of people with missing teeth, crooked teeth, or whatever don't have and will never develop any TMJ issues. And there are those who have perfectly straight teeth and have all kinds of TMJ issues. No one can make the claim, if you get braces, your TMJ pain will go away. At the same time, there are anecdotally those who have their bite corrected by filling in missing teeth and are once again able to chew on both sides and their TMJ symptoms improve. Hypothesized risk factors for developing TMJ problems number 2. Psychological factors such as depression, anxiety, and stress. The research supporting this is conflicting. The truth is that stress and anxiety may increase muscle tension and lead to muscle fatigue and potential muscle pain. But are they the cause of TMD? Depression has been associated with TMD. Again, is it the cause or a result of TMD? Basically, there's insufficient evidence to support the use of psychological interventions either as treatment or for prophylaxis. The vast majority of people with depression and anxiety have no TMJ issues. Also, there are perfectly happy people who experience TMJ pain. However, anecdotally, some individuals with chronic TMJ issues may have great improvements by simple reassurance, relaxation techniques, and psychotherapy interventions. Hypothesized risk factors for developing TMD number 3. Hormonal changes such as increased estrogen and reduced testosterone levels in women. And there's actually research to support this. TMD is 5 times more common among women than men, which is hypothesized to be due to greater estrogen levels leading to TMJ ligament laxity. TMJ pain increased by 20% in women using oral contraceptives and by 30% among menopausal women on hormone replacement therapy. Despite the association, there's no evidence to support the use of hormonal interventions either as treatment or for prophylaxis for women with TMJ issues, although there may be anecdotal cases. Hypothesized risk factors for developing TMD number 4. Trauma such as whiplash injury or direct blow to the mandible, and there's research to support this. This should not come as a surprise. If you bang your thumb with a hammer, it increases the chances of you having thumb pain. If you get punched in the face, it may also increase your chances of experiencing jaw pain. No kidding! Onset of TMJ pain was directly correlated to a specific trauma in 25% of men. Interestingly, those with and without history of trauma had similar recovery times. Although trauma is certainly a risk factor in the development of TMD, the majority of patients with TMD have no history of a single trauma to their TMJ. Motor vehicle accidents are a cause of TMJ problems. However, the stress of litigation and the perceived fault and anger at another driver are risk factors for central sensitization. These patients are sometimes told TMD is not related to the MVA and that they are malingering or faking their pain. However, this will create distrust of the medical system and prime them even further for central sensitization. Hypothesized risk factors for developing TMD number 5. Parafunctional use of the TMJ such as bruxism, one-sided chewing, nail biting, and there's research to support this. habitual clenching and chewing gum for more than 2 hours a day has been shown to be a risk factor in the development of TMD. The prevalence of bruxism is 20% among the adult population and 38% among children. Usually, parents feel quite uncomfortable hearing their 5-year-old child grind their teeth at night. It's simply a habit and not necessarily related to stress. Most, of course, just grow out of it. In summary, parafunctional use of TMJ is certainly a contributing factor to TMD, so gum chewing, pen chewing, one-sided food chewing, nail biting, and bruxism must all be appropriately addressed. Hypothesized risk factors for developing TMD number 6. TMJ hypermobility and general ligamentous laxity. And there's some research to support this also. The presence of both local TMJ and general body hypermobility is more prevalent in patients with TMD. However, even though hypermobility is associated with TMD, there is no evidence today to provide ideal intervention options for hypermobility. Hypothesized risk factors for developing TMD number 7. Hereditary. And the research doesn't support this